This is Carl Fiber. He's been a long-time upper cervical patient, albeit he had a lapse in care for a year and a half or two. But he's going to tell you how he ended up in our office about 2 years ago, I think, around 2 years ago.
Something like that. Okay. About 2 years ago, I had get up one morning, I couldn't get up, couldn't move. We went to the doctor at Cedars-Sinai, and they checked and they said, well, you have a herniated disc. And he said, after they checked it, they said, you need to do the operation. Let's schedule now. My wife said, okay, let's schedule, but let's take a second opinion and see with another doctor. We go to another doctor on Cedars-Sinai, and he tells me, you need to take a shot. You don't have to have operation, but you take a shot. I said, okay, how long is those shots going to work? Well, about 2 weeks, 3 weeks. And I said, what then? You have to take it again. I said, that's not an idea, a good idea. We go to the third doctor. He said, well, you need to exercise your back, you pick up your knees, and this and that. I said, wait a minute. I cannot move. Are you telling me to exercise? Here comes the lady that does my wife's hair. And my wife telling her that she had the same problem like I did. And she said, in Koreatown, there is a doctor. She gave my wife telephone number. My wife made an appointment. And I said, well, Koreatown, it must have been Korean doctor or something like that. And they know more than our doctors. We go to Koreatown and open the door, we get in. Who's there? A young white guy. Well, it was kind of, interesting. Then they check my neck, and he tells me, your neck, it goes kakait. Okay. Then what he does, he lays me down on a bench, gives me a slight knock on my neck. And I said, it's going to help me right away. He said, no, it takes a little bit of time. He said, because the fluid has to continue going from your brains with the nerves into my back and heal itself. After 3 days, I went again. Again, I got a knock on my neck. But then I started feeling better because before I barely could move. I couldn't bend. I couldn't put no clothes on myself. My wife had to help me with everything. Then about after a month, after a few treatments like that, after a month or two, not only my herniated disc pain started disappearing, I used to have a chronic pain in my back, across the back. That one started disappearing because before I couldn't even bend to wipe my feet after the shower. I had to kind of pick him up on a bus stop and bend it in such a way that I can wipe. Now I have no problem. I have a gardening, I'm doing the gardening, I'm bending, no pain, I'm walking, no pain.
So I guess you didn't need surgery then, huh?
No, I didn't need no surgery, I didn't need no shots, and I didn't need no exercises the way the doctor, exercise that helps for some other reasons, but didn't need to. Now I'm coming to Dr. Hall. It's to try to reduce my blood pressure, which it did come down because I'm trying to get away from blood pressure reducing pills.
So basically what Carl's saying is he came in because he was scheduled for back surgery. We corrected him. That cleared up. He dropped out of care because he was happy with that result. He's come back about 4 weeks later, and he's been here back for about 4 weeks. How much lower is the blood pressure since you started?
Well, it went down from, on the first occasion it was like 122, which I never had before. Usually when I used to go to Cedars-Sinai, my blood pressure used to be like 146, 150, or a little bit above. For the past couple of times that I checked my blood pressure, it was like 133, 134. But that's because maybe my big body and too much blood. I don't know.
All right, Carl. Thanks a lot.